Bismillahirrahmanirrahim. I am Dr. Imtiaz Ahmed, ENT specialist working in this medical center for the last 20 years. The topic for today's discussion is the management of epistaxis. This is a very common occurrence in our general community. Epistaxis is defined as the bleeding through the nose. It may arise from the nose itself, or there are small passages on the side of the nose, sacs, which are called the ears. These nasal sinuses, it can come from that, or a part behind the nose is a part of pharynx, we call it the nasopharynx. It can come from anywhere. It can involve any age group, small from the small children, adults, and the adolescent. In all, it can occur. It is very common because the nose is the very prominent part of the face. So any trivial trauma or any trauma can cause this, and it is a very vascular area. Here, both the internal and external carotid system, which supplies the head, they anastomose here, and there are especially two areas. The middle part, which is the partition of the nose into the both nares, this is called nasal septum. The anterior inferior part, that is the lowermost part of that septum, there is a little area which is called the Little's area. Here it is the vascularity, more vascularity, and from here it is this most common sort of site of the bleeding. Also, there is a posterior part of the nose where this is occurring, and it mostly trickle in the throat, and then from nasopharynx it comes through the throat. So basically there are two types of bleeding: anterior nasal bleeding and posterior nasal bleeding. Anterior nasal bleeding starts from the little area. It is very common, and this is mostly in the children at the young age, and most common cause for this anterior nasal, which is dribbling from the nose, is the trauma. Whereas the posterior is mostly it is in the adults and blood pressure or the cardiovascular diseases, the major trauma of the accidents like skull base or something, and it is rare, and it presents in the back side of the nose, and through the oropharynx is come out. There are a lot of causes for this bleeding. Local causes, as we did, that trauma is by far the most common cause. Very little trauma, like was just your finger pricking with the finger, the nose pricking with the finger, or some history of fall, fight, or some of these sports which are not so sporting sports like cricket or rugby or some football. So nasal trauma can cause the epistaxis. Then infections in the nose or the paranasal sinuses. Foreign body can be a cause for this epistaxis. Foreign body may be a living foreign body or a non-living foreign body. Living foreign body, we know the leeches. These are the sometimes found in the pond water, or sometimes if some person do wudu from there, or some there the leech come in them and it sucks the blood from the septum and throws it out. And sometimes the non-living, then some, if there is in the small children, some foreign body is they put in the nose and nobody removes it, so it forms a rhinolith which can cause the bleeding. The rare causes of the cancers, neoplasms. In the young adults, this is common is the juvenile angiofibroma, which is a very common, and it is in the nasopharynx, whereas the other rarely are these tumors in the nose and paranasal sinuses. And sometimes there is only the deflected septum. If there is this septum, this is a partition of the nose. When it is deflected with very acute spur, so that acute spur can cause this trauma to the overlying blood vessels and mucosa and start bleeding from there. So it can be a local cause for this epistaxis, or there may be a general cause for this. common is this hypertension in old age cases, and also sometimes in pregnancy due to this hormonal imbalance or due to the hypertension of the pregnancy, this bleeding can start. And there are some blood and the blood vessel diseases like purpura, thrombocytopenia, leukemia, and all these things. Sometimes patients are taking some drugs like most aspirin or some other thrombolytic drugs or anticoagulant drugs for some cardiac problems or something. So this all cause this epistaxis. So epistaxis is a very mostly there are very small amount of blood is lost. So it can be acutely treated at this our emergency or local site. This is showing this is the which instruments which is commonly in our ER just for packing are these instruments. So when we can want to treat this epistaxis, first of all we have to assess what is this condition of the patient, how much is the epistaxis, what is the mode of onset of epistaxis, what is the duration and frequency of this nasal bleed, and how much of the blood is lost. We would see the skin, pulse, blood pressure to treat. Sometimes it is profusely bleeding and patient may be in the shock. So we have to assess that. We have to see the site of the blood loss from where this, for examining the nose, from where it is blood is coming. And as I discussed, type of the epistaxis, that it is anterior part of the nose or posterior part of the nose. And we have to take the history that patient or in his family, there is a bleeding tendency, or he is a known case of some cardiac diseases or some other diseases, or some drug intake history is there. So epistaxis, first of all, we have to think that if there is epistaxis, this is the position which is on this, which with proper position. And on the left side is also acceptable, but mostly in the front line, in the houses are there. We have to pinch the nose, open the mouth, and frontally open the mouth on a wash basin and pinch for 10 to 12 minutes. This is the emergency treatment of this epistaxis, immediate. This is showing the pinching of the nose, mostly as it is from little area, which is this cartilaginous part of the nose. So by pinching it and opening the mouth, sometimes we can put the two spatulas, wooden spatulas on this nose for this pinching. This I was told that this is the little's area, which is shown here. And most commonly this is from this cartilaginous part of this nose septum. So pinching is, it isn't done properly and there is very little blood loss, so it can be compressed and stop. And in addition to this, we have to do some cold compression. We can put the cold water on the head or apply some ice on the forehead, nose, or the bridge of the nose or the side of the nose, and it can compresses the blood vessels and stop the treatment. If by this emergency treatment, by pinching and this is not stopping, or it is reoccurring, then we have two options. Either we have to do this cauterization, that is we burning out the point from where the blood is coming, or we have to pack the nose. So cauterization, maybe this is burning of the blood site area from where the blood vessel is bleeding. It is just like welding. It can be done electrical or chemical. And we have here silver nitrate sticks here. 70% silver nitrate sticks are available in our clinic. And just by it is done when we have to actually visualize. If bleeding point, we can visualize. And it is accessible. It is by seeing it is accessible. Don't we have to apply blindly, and don't we have to apply on both sides of the nose? And if it is visible, then we have to apply that. And next. And sometimes this local anesthesia is needed. For this, we have to 5% this xylocaine with the adrenaline. we can put this platelets in that and put 5 to 10 minutes for local anesthesia. Good elimination is needed, the head and we have to examine, and suction should be there, and we suck all the blood and see from where the bleeding point is. If visible, then we see that visible bleeding point, and then we cauterize it by using this chemical cautery of silver nitrate, or by using this thermal cautery. Now we have just a new machine arrived, which has the option of the thermal cautery, and under the local anesthesia, we can cauterize the local the bleeding point. Next. So just 1 to 2 cautery sticks we dipped in water, as I told, and apply this. And if there is a bleeding point, we gently after this apply gentle pressure, and there is any excess of the silver nitrate, we just run it out. Next. And never cauterize deeply or too much pressure on this, and never try to on the same side, on both sides of the nose, because it can cause the septal perforation. And when we do it, afterwards we have to apply some antibiotic ointment and instruct the patient not to use the same precautions like prop up and don't cough or don't do the pressure. If there's some sneezing is coming, he should sneeze with the open mouth, or some pinch on the labule just below the nose. It can stop this sneezing. All these are to decrease the intracranial pressure, and which causes the bleeding again. Next. So the patients who are cauterized, they should gently apply the antibiotic ointment and instruct the patient to maintain an upright position, as I told. Next. And direction of the instrument should be with this along the floor, and we should take half this. If cauterization is not with this cauterization of the chemical or electrical, this is not stopping bleeding, or we cannot visualize exact from where it is coming, then the next option is the nasal packing. Next. Nasal packing is anteriorly, we can do from anterior, from the nose, or it is a posterior. Most common is the anterior nasal bleeding. So anterior nasal packing is done. And if the cautery fails or the bleeding point is profuse and we cannot localize exactly, so do we have to apply this nasal packing. The principle behind the nasal packing is by pressure and not to put a lid on the nostril. So it should be thoroughly done under direct visualization. Next. And this is showing this. We can use the 1/2 inch ribbon gauze soaked in some liquid paraffin, and also some antibiotic ointment on it, because it has to be put in from at least for 48 hours. So antibiotic ointment should be done, and it is done like this. The first from floor we have to start and do like this packing. Next. Next. Neck. Next.